Hi, my name is Dr. Nefisa Omar, and on today's episode, we'll be talking about home therapy protocol and physical fitness and rehabilitation, as well as postural hygiene maintenance. Now, what is the home therapy protocol? Is what are the set of principles or guiding principles that we encourage our patients to carry out while they are at home, the essence of which is to encourage, number one, self-care, number two, pain relief, and number three, spinal flexibilities. Now, on the issue of home care protocol, it is very important to note that perfection cannot be attained in one day. It's important, however, to make progress, to do little activities gradually over a space of time. Now, for home protocols, I would recommend 3 basic steps. Number one, you need to take cognizance of pain relief. How do you achieve pain relief? You achieve pain relief through what is called articular fomentation. What is articular fomentation? It's just big English for application of moist heat to the site of pain. Now, the site of pain usually in the clinic when patients come in is usually with the lower back, the upper back, the shoulder, and the hips. So application of moist heat therapy can be done either by using a warm rag over said spot or using a hot water bottle or heat pack to achieve fomentation, articular fomentation. You can also make it more effective by the use of any sort of analgesic ointments, whatever works for you. Either you want to use hot balm or Chinese balm. I personally find that to be abrasive. I'd rather just go for something, anything with methyl salicylate, like Bengay ointment or neurogesic ointment over the spots that you are having pain. So for example, if it was your posterior superior iliac spine, you could apply that over the set spot first, and you then apply your hot water bottle after. And then you sustain that over for like 5 to 10 minutes. The idea behind that is it allow the pain relieving substance to penetrate into the muscles that are tight, thereby disallowing or disengaging any spasms that is occurring within that area, and then also negating the use of oral painkillers or oral drugs. Now, another thing that I would like to also speak about is basic stretch exercises for the back and for flexibility, for the essence of trying to improve patients' flexibility. For the most part, patients are within that mid-age bracket, so 45 to 55, and number two, patients may have never engaged in any sort of stretches in their lifetime. So when you are, as a doctor, when you are trying to encourage patients to do exercises, what I like to do is to just give them a couple of exercises that they can start with and then gradually build up on. Now, exercises or stretches that I like to give, most of the time I always look at the physical presentation of how that patient presents, where the site where the patient is having the pain, and then also if or not the patient has any form of radiculopathy. We all know what radiculopathy is. Radiculopathy basically is a transfer of symptoms from the original point down the extremities, so depending on which of the nerve roots are affected. So, but most at times, I just have a general protocol that I like to follow, basically using the McGill Big 3 principle. I'll give you like 2 basic spinal stretch exercises and then 1 core exercise. So for the first exercise I like to give is a back extension into child's pose. And the second one is alternate arm and alternate leg. What that does is essentially give the deeper muscles of the back some sort of strength or some sort of stabilization. Is a stability exercise. The first one is more of a flexibility exercise, that is back extension into, that is cobra into child's pose. If you are familiar with yoga, you will know what I'm talking about. Then talking about alternate arm and alternate leg, that basically activates your stability core, or should I say stability group of muscles in the lower back. And last but not least, I always like to do some sort of extension bridge glutes / multifidus exercise / hip flexor stretch. That is a hip bridge or hip extension. So that is the patient will be lying supine and looking upwards. Then alongside that, I also like to usually give a patient, as time goes on, I add a core stability exercises. So activating the anterior, that's the core muscle. So you can have the patient do something like a plank or a bug stance. And each of those stretches, as I've mentioned before, will give about 10 to 15 seconds hold. And then repeat 2 or 3 times to ensure that the patient gets isometric strength. Now, it may not look like a lot, but over time, you do it increments. This is the way we grade the exercises, that we increase the number of seconds that the patient takes to hold those stretches. That way, the patient's endurance improves, the patient's flexibility improves, and also the patient's strength improves. In conclusion, home therapy is essential for the relief of pain, to prevent relapse, and to encourage flexibility of tight muscle groups within the back and in the entire musculoskeletal system. See you in the next class.